So here we're talking about right side dominance and how we are built as asymmetrical beings and not symmetrical as a lot of us are led to believe. So how we are designed. So we are heavier on our right side. So if we cut ourselves down the middle and split ourselves in half and we weighed each side, our right side would be heavier than our left side. It's because of more organs and the size of our organs on our right side compared to our left side. Now, a lot of that has to do with our bigger right diaphragm. So we use this muscle about 26,000 times per day because that is the amount of breaths that we usually take each day. So with having a bigger right diaphragm, as you can see here, if this is the spine and we split right down the middle, it's 3 times the size of this little left diaphragm. So our right diaphragm, it maintains a domed shape thanks to the liver placement that's just set above the diaphragm on the right side, which when the diaphragm can maintain a domed shape, then air will easily go into there. So if we're breathing 26,000 times per day and air is more than likely to just go onto this right side, that is going to be a pull onto the right side and further weigh us down on that right and increase that right side dominance. It's basically exactly where it's coming from. This is the most underrated muscle in the entire body. Diaphragm is the king of everything. So we use our left brain more than our right side. We use our left side of our brain more. Our left side controls our right side of our body. So our left side of our brain has more sensory receptors. Therefore, we have more sensory receptors on our right side of our body. And again, we favor that because we're sensory beings and we just sense everything. So if more sense on the right, we're going to be more alert to that right side. So then we have a right side, which is a state of exhalation. So these ribs here will be low and closed, whereas our left side is in a state of inhalation. And that's where you get this opening here. So as you will see in some of the other videos and a lot of the drills about ZOA and claiming the ZOA. So this is what it looks like when there is no left ZOA, where this whole lower part of the rib cage is flared open and this side here is down and closed. So that means no air is coming here at all. This diaphragm is not domed, no air. This diaphragm is domed, lots of air. So as you go through, or as I provide programs for you, this can happen on both sides. So this state of exhalation can appear on that right side as well. Inhalation can appear on this right side as well. So you can get this on both sides. But underneath that, there is always left side that is flared more. Then we have right stance. So this is what this all looks like on the outside. So everything I just explained is what's going on the inside. That's going to dictate what happens on the outside. So we get in what's called right stance. So you could even be standing on your left leg, but your pelvis or your hips will be orientated to the right, which what we need as humans is to be able to get onto the left leg and orientate our hips to the left. That's how we walk. So how that looks, we have a pelvis that faces to the right. So that left pelvis faces to the right. As we go up, our spine is orientated to the right, but then our rib cage counters to the left. So then what we get there is a rib cage that doesn't move. And if we have a rib cage that doesn't move, then we cannot walk properly and just more and more tension builds up. Now as we go up further, this is where it gets a little bit complicated, or very complicated actually, because this is where all our autonomics are. So a lot of our sense comes from our hands and our feet, but a massive chunk of it is all through here. So the amount of information that goes through our eyes, through our dental occlusion, and through our ears as well, the information that goes through there into our brain is what causes a lot of torsions through here, because ultimately we are moving forward. That's what we want to do. We're moving forward as human beings, so we will compensate and counteract everything to maintain that. So torsions here, neck can side bend, it can rotate to the left, jaw can start sinking back, and so you'll get this overbite, and then even our bite on the left to the right is uneven, and this is the most common for anything going on up in the cervical area, is more of a bite on the right hand side. Oh, sorry, not cervical, cranial area and cervical. There's more of a bite on the right hand side. So if our molars contact more on the right, we're going to ground onto our right. So that's what occlusion does, is it helps us ground to the floor. And we lose the left bite, which means we have no grounding, and we can never fully, as far as our brain is concerned, get onto our left leg. So sensory beings walking around in a bag of meat. So this is us. So when you peel away the muscle or the skin or the blood, this is us. This is what controls the muscle. This is what controls us. Our thoughts, feelings, emotions, pain, feel good, anything. This is us. This is ultimately what we are. And so much attention is given to muscles when we should really start at the start. This is the start. And that's where you hear neuromuscular. And that's why neuro is always before. Neuro is in charge of the muscles. So we have, as I mentioned before, we have more sensory receptors on our right side of our body. So our left hemisphere, our left side of our brain, will control our right side of our body, more receptors, more dominance, and our right hemisphere of our brain controls our left side of our body, which we have less receptors on that right side. We're then grounded on our right side through occlusion, so we sense, that's part of our one of our sense is dental occlusion, and on this right side we more than likely will have more of a bite, which means then we ground ourselves on our right hand side as far as our brain is concerned, and we have a less contact on this left hand side. So therefore, again, as far as our brain is concerned, we are never really getting onto our left hand side. So then we also have grounded on our right side from the lack of left peripheral vision. So this is very common for more modern times where we are in front of screens all the time. So if you're thinking, if you're a desk worker, or just someone here who watches a lot of TV on the looking at the phone all the time, or any screen, even reading a book, our left eye loves to be the focus, so it will focus in and it will track what you're reading on the screen, whereas our right side still does that, but it keeps the peripheral vision and is our scanning eye. So it's scanning our surroundings for our brain to let us know if our environment is safe, and we completely lose that on our left hand side. So when our left hand side just narrows right in, then we lose that peripheral vision, and it's no longer, as far as our brain is concerned again, it is no longer safe for us. So then we restrict our movement, or the brain restricts our movement, we lose range of motion, and then if this is left unaddressed, then pain will start setting in, where it could be anywhere in the body where that pain will start kicking in, and no other other treatments may provide some relief, but you're never going to fully get it if we recover from this, or should I say, we're never going to be able to fully treat it if we're not getting to the source of the issue, which the source could be from the lack of peripheral vision. Extension pattern and compressed on one side. So what we see here is a pelvis this is what our pelvis should be able to do, is orientate and get back into that left hip and get out of that right hip. Then we should be able to get back into the right hip and out of the left hip. Now, unfortunately, with the right side dominance that we all have, a lot of us are stuck in this position here, where our left hip is orientated forward and to the right, and this right hip is back and compressed, especially around all this here. Now, you can get left side back pain as well of overly lengthened tissue. And over here is compressed tissue. So as I said before, pelvis facing the right, rib cage counters to the left, and then we've got a whole big mess going on with cranial torsion up here to maintain a sense of neutrality. Now our brain gets into a position where when we get into this extension pattern of where it thinks that we're always falling forward. So our center of mass comes over our toes. So this is obviously very exaggerated, this picture here, but it is a great great image of what our brain is basically thinking is going on. Our center of mass comes forward onto our toes. Our hips go into an anterior pelvic tilt, so they tilt forward. We then compress all the way up the spine, especially that lower mid-back right there. These ribs flare, so when we breathe in, air is only going forward, it's never going back. If it's going forward, it's going to push us forward more and compress us more. Then our neck will compress around here, and now, as I said before, this is all autonomics. So if we're compressed here, it's very, very hard for us to regulate our state, and our ability to manage stress is almost completely gone when we've got this compression through this autonomics here. So fully lengthened through these through the neck flexors here, and just compressed. So this is basically what our brain is feeling like is what's happening when this whole right side dominance and this extension pattern is not addressed properly. So next slide is exactly that image that was just on before, just on what's going on the inside. So a lot of us are in this open scissors pattern, so the extension pattern, where spine and rib cage is compressed. If we're looking from a muscle standpoint, we've got very tight lats because we're compressed. We've got a tight mid to low and upper back, and shoulder blades are stuck. So if you look at this image here, and we look at the cylinder, that's your shoulder blades. So it's got a nice stable structure to sit up against, and there should be no need to tighten up, but much less likely to tighten up and be stiff and sore. Whereas if you look here, and if our ribs are flared up forward, and this is our scapula, it's now away from the rib cage, so it has no foundation whatsoever, and it will just tighten and tighten and tighten no matter what you do, no matter how much stretching, because what the problem is the rib cage is flared and compressed here, and it's not in a nice neutral low position at the front like this, where we can get air back. Get air back, those shoulder blades can calm down, and the entire spine can decompress. The only way that the spine can decompress is through gas expansion, and that's or breath. So and finally, autonomics. So life weighing us down. So our autonomics is our brain or our sympathetic system and our parasympathetic system. Now this is something that we need to be able to, well, which we do jump between daily, all the time. We go back and forth. But what the problem is when we get stuck in that sympathetic system, and it's yes, we can go back to that parasympathetic, but we're more than likely to just be, let's say, over here rather than being here and just swaying back and forth. So when this happens, we become very under recovered, and this is what I see is a lot of people in this under recovered situation. So when you think of something like exercising, yes, exercising, gym work, weight training, all that is great for us, but we're most likely already in this under recovered state, which will just get worse and worse and worse if left unaddressed. So under recovered, more susceptible to stress. We don't know how to manage stress. We become anxious, start predicting the future. You know, that's anxiety. That's all anxiety is we are predicting the future from past beliefs. So we get very stuck in our own heads. Any trauma can put us more into this autonomic state of disarray and just not being able to regulate, and more susceptible to depression. Now, a lot of this is, not all of this, but a lot of this will be related back to just breathing issues and respiratory issues. So faster breathing patterns will happen. When that faster breathing happens, all of this is exacerbated, and we get very sympathetic muscle tissue. So, for example, sympathetic muscle tissue is like a low back that when you touch it, it feels quite tender. You get that tenderness, or the back of the neck can feel quite tender. Any muscle really that is tender is and short and tight is a sympathetic muscle that does not know how to lengthen. So it's a stressed muscle, and that can only be lengthened by telling the brain that it's okay, let's relax, and become parasympathetic. So things that can exacerbate this is things like alcohol. So if we're talking about the right side dominance, of course. So the liver sitting on top of that right diaphragm, that's already getting 26,000 times at least breaths or contractions per day as a muscle. We've got the liver sitting on top of it, as I said before. Now, if you add alcohol into the equation, that liver has to work so hard to process that alcohol, and all the surrounding tissue around there will become very sympathetic during the time that it's processing. Now, that can last up to about 3 days after a good drinking session. It doesn't take much really for alcohol to make the liver work hard. So just keeping that in mind, especially when if you're finding you're waking up a day or two after a few drinks and you realize or notice that pains are a bit, and joints are a big one, a bit more sore and stiff. So that's just an idea of what's going on in the body with that. But alcohol will put us straight into mouth breathing and snoring. So even if you don't regularly snore, when you consume alcohol and you go to bed, that mouth will be open. You'll be snoring for sure, and that'll put you straight into extension. So it doesn't really matter how you're sleeping, on your back, side, front. That rib cage will flare. Your breathing will go forward because that's the easiest way that it can. And just put you straight into extension and weigh you down more on that right hand side because of that liver. So inflammatory foods as well can contribute to this. This is for some people, not everyone, but things like dairy and gluten. And and always constricted, airways constricted in any way. So a high chance of being in an extended pattern. So that could be anything from asthma or any other, or cystic fibrosis, any sort of respiratory issue. If you suffer from allergies, so your respiratory system will be under stress more. So sinuses, all that sort of things. Any sort of constriction, even down to just cardiovascular, your fitness level. So that is a restriction in the airways. Therefore, the body has to work twice as hard just to rest, just to be at rest. Therefore, putting us into the easiest way that it knows, and that's weighing us down on that right side, and which is just further exacerbating that right side dominance. So as what we will go through in further videos, whether or not you've watched the ZOA and AIC just yet, further explaining a bit more about this. But this is just giving you an idea of what of how we will just balance ourselves as far as the brain is concerned, how we organize our center of mass, and that's the key thing. If we can organize our center of mass to sit back on our heels and rest, and lower our rib cage, like in the ZOA, as I've spoken about, or will speak about if you haven't listened to it. It's all about getting back on the heels, decompressing the spine, and being able to breathe back. And right side dominance is just an emphasis on breathing into that left diaphragm, getting those left the front of the rib cage nice and low on that left hand side. That will be able to ground us more on that left hand side, and depending from person to person whether or not something else needs to be addressed in terms of eyes, so visual system, or occlusion. So I hope that helps. If you need any more information on this, just feel free to ask me at any time.